Hello everyone, I am Dr. Ruchika and welcome to Creating Balance. Type 2 diabetes is a chronic complex disease which affects millions of people worldwide. In our body there is a hormone called insulin and it helps to move the glucose from our blood into our cells where it is used for energy. But in case of type 2 diabetes, the cells of our body don't respond well to this insulin. So there will be increased levels of glucose in our blood itself. This can lead to various symptoms and various other complications also. In this video, I will talk about various symptoms, causes and certain lifestyle changes that can help you to deal with type 2 diabetes. So let's begin the video. First of all, let's talk about various symptoms associated with type 2 diabetes. Initial symptoms of type 2 diabetes include lack of energy or fatigue, unexplainable weight loss can be there, excessive thirst or dry mouth can be there. Then frequent urination, blurred vision or itchy skin are also common symptoms associated with type 2 diabetes. Then as the disease progresses, the symptoms can become more severe. Like there can be delayed healing in cuts or wounds, then there can be dark patches on the skin. There can also be foot pain or there can be feeling of numbness in the extremities like in your hands or in your feet. Now let's talk about various factors that can lead to type 2 diabetes. The factors that can lead to type 2 diabetes are divided into two categories. First is modifiable factors and then second is non-modifiable factors. Modifiable factors are those which are under your control, which you can change by adjusting your lifestyle. But non-modifiable factors are those which you can't change, which are not under your control, like your age, gender, genetics, etc. And modifiable factors include your diet, lifestyle, then your weight, stress, sleep, physical activity, etc. In this video, we will mainly focus upon three main modifiable factors which are under your control, and how you can adjust those factors to keep your blood glucose levels in check. And first such factor is your diet. What you eat affects your blood glucose levels. So it is very crucial to eat healthy, not just if you have diabetes, but also as a part of healthy lifestyle. For diabetic people, there are certain factors in terms of diet that they need to take care of. First is to replace refined carbs with whole grains. As a diabetic person, it is very important to avoid refined carbs as much as possible. Now for diabetic people, it is also very important to increase their fiber intake. For that, you can increase the amount of vegetables in your diet. Fiber is very important and plays a very crucial role in controlling diabetes. You can also include millets in your diet because millets release glucose very slowly as compared to wheat and rice, so it never spikes up the blood glucose levels. Then you can also include fruits in your diet, but try to avoid fruit juices because fruit juices are completely devoid of any kind of fiber. So avoid fruit juices, instead you can consume fruits. And also make sure to consume foods first thing in the morning. Try to avoid fruits after your meals or even in between your meals. Fruits should be the first meal of your day. Then you should also try to avoid sugared beverages and not even get fooled by the diet beverages. You need to avoid them too. Then refined sugars should also be completely avoided in case of diabetes. Then people with diabetes should also avoid saturated fats in their diet. Products like chips, pastries, biscuits and salty snacks, these all include saturated fats. Instead of having saturated fats, you can consume healthy fats which are found in nuts and seeds. Because along with having healthy fats, nuts and seeds also contain a lot of fiber which is very good to manage diabetes. The next modifiable factor which is very important to control diabetes is exercise and physical activity. It is very important to adopt and follow good physical activity levels for glucose management and for overall health in case of people with diabetes and pre-diabetes. Both exercise and physical activity throughout the day are very important. Exercise is known to improve blood glucose control in type 2 diabetes. Aerobic training or aerobic exercise increases mitochondrial density, insulin sensitivity, lung function, immune function, and cardiac output. As diabetes is known to decline muscle mass, so to improve muscle mass and to maintain bone density, it is also very important to include strength training. But if you have never exercised before, always make sure to start slowly and do exercise according to your capacity. Adults with type 2 diabetes should prefer both aerobic and resistance exercise training for optimal glycemic control. Then daily exercise or at least not skipping exercise for more than 2 days is recommended to enhance insulin action. Everyone, but particularly people with type 2 diabetes, should interrupt their long sitting hours with bouts of physical activity every 30 minutes and avoid sedentary lifestyle. Now, this increase in physical activity is in addition to daily exercise. Both exercise and physical activity are irreplaceable and non-negotiable, especially in case of people with type 2 diabetes. The next modifiable factor which can help you to manage diabetes is stress management. Stress has been recognized as a risk factor for type 2 diabetes. Under stress, our body undergoes various changes like release of stress hormones that increase blood pressure, a surge in blood glucose levels, and our immune system also gets activated. Constant stress can make it very difficult to control your blood glucose levels. Also, by managing your stress levels, you can also avoid the risk of various complications related to diabetes. So by following the points explained in this video, you can actually keep your blood glucose levels in check. That's it for today's video. Thank you very much for watching.